Very important information that the nurse must obtain when assessing the pregnant woman is prenatal data. The nurse should review the prenatal record to discover the individual needs of the patient. If the woman has no prenatal care or the records are unavailable, essential baseline data needs to be obtained. The objectives that we will address in this lesson are to review the factors included in the initial assessment of the woman in labor and describe the role of the nurse during labor and birth. The following data needs to be reviewed or obtained: the obstetric and pregnancy history, including gravida, parity, and pregnancy problems such as bleeding, gestational diabetes, gestational hypertension, preeclampsia, and so on. The expected date of birth, or the last menstrual period if the woman has not had prenatal care. This date will allow the nurse to determine whether or not the baby is premature or term. The age of the mother, the immunodeficiency status, patterns of weight gain through pregnancy, vital signs. You need to measure the fundal height, get a baseline fetal heart rate, review the laboratory and diagnostic results on the mother, review any fetal diagnostic tests performed, including amniocentesis, non-stress tests, biophysical profile, and ultrasound. If this is not the first birth for the mother, birth characteristics from the previous pregnancy need to be reviewed. During the interview, the nurse will determine the woman's primary reason for coming to the hospital. It might not be labor. It could be another pregnancy problem. If the primary reason for coming to the hospital is that she believes she is in labor, the nurse should assess the following. First, the nurse should assess the contraction pattern. She should assess the time, onset, frequency, duration, and intensity of contractions. The nurse should also assess persistence of this contractions despite walking or changes in position, location and character of discomfort or contractions, presence of vaginal discharge or show. Note, if the woman has had intercourse recently or a vaginal exam in the doctor's office in the last 48 hours, a small amount of brownish to bloody discharge may be noted. The nurse should also assess the status of the amniotic membranes. Methods of testing for rupture of membranes will be discussed later. Once the nurse has determined whether the patient may be truly in labor, the nurse will continue with her assessment. This should include assessing the respiratory status. Does the woman have a cold? Has the woman had any issues with her respiratory system? Does she have any allergies? Are these allergies to different drugs or foods? Any type of allergies that might affect the woman in labor. Does the woman have a birth plan? In a birth plan, the woman will have preferences for her labor and birth. Contents of a birth plan are generally individual. You may review a typical birth plan in your textbook. Discuss pictures or videotaping at this time. When this is discussed, it is important to know the facility's policies. Some facilities or healthcare providers do not allow videotaping or pictures because of liability concerns. Next, let's discuss assessing for rupture of membranes. The first test we'll discuss is the Nitrazine test. With the Nitrazine test, dip a cotton-tipped applicator that has been impregnated with nitrazine dye for determining pH. Nitrazine tape may also be used. Amniotic fluid is slightly alkaline, while urine and other fluids are acidic. The results run from yellow with a pH of 5.0, olive yellow with a pH of 7.0, deep blue a pH of 7.5. Positive for rupture of membranes indicate the blue, the dark blue, or the green. False results are possible due to bloody show, insufficient amniotic fluid, or semen. Another method of checking for rupture of membrane is ferning, or the fern pattern. In this test, you spread a drop of fluid from the vagina on a clean glass slide with a sterile tip cotton applicator. You allow it to dry. Examine under the microscope for a ferning appearance. Positive results or ferning noted indicates rupture of membranes. In this picture, you see an actual fern leaf. In this picture, you see a slide of vaginal fluid that's under a microscope. If you notice, the appearance is the appearance of fern leaves. This is another slide showing ferning. This concludes this section of the lesson.